So there's two axes. One is y-axis. So y-axis, what is present? Left ventricular pressure, and x-axis is left ventricle volume, right? So these this black loop show the normal pressure volume loop, and this is normal and systolic volume, and this is normal and diastolic volume. We already discussed these concepts in the previous session. So first valvular disease is aortic stenosis. So the aortic stenosis. So what happened in the aortic stenosis? So aortic stenosis lead to increased left ventricular pressure, right? The aortic stenosis lead to the increased left ventricular pressure, right?
Right.
So if the aortic stenosis or mean arterial pressure is increased, what happens to the stroke volume? It will increase or decrease? It will decrease in stroke volume, right?
Yes.
So you know the concept, but it is a difficult when you put these concepts on the loop, right?
Yes.
USMLE love to ask these kind of the loops. You have idea about these things, but you have no idea about the pressure volume loop. So this type of the question become very difficult for you in real exam, in NBME, in UWorld, right? Okay. So what happened when mean arterial pressure and aortic stenosis take place? What happened to the end systolic volume? Increase or decrease? Increase or decrease? Can anybody talk?
There's no change to the end diastolic volume, but your end systolic volume will increase.
End systolic volume, because heart is working against the higher pressure. So it's not easier to push the blood out from the ventricle. So more blood remaining at the end of the systole. So it means end systolic volume will increase.
Increase.
Right?
Yes.
Okay. Now put these things in the pressure volume loop. So this is left ventricular pressure. This is left ventricle volume. This is normal and systolic, and this is normal and diastolic volume, right?
Yes.
Okay. So in aortic stenosis, the pressure of the left ventricle is increased. You noted that. This is normal pressure of the left ventricle, or this is increased. So pressure is increased. So one thing, left ventricle pressure is increased, right?
Yes.
This is normal and systolic volume, or this is and systolic volume in aortic stenosis. So it will increase or decrease in graph?
And systolic will increase.
Increase. And what happened to and diastolic volume?
Nothing, no change.
But no, usually not change, remain unchanged, right?
Yes.
So stroke volume, what is the formula of the stroke volume?
Yeah.
And diastolic
minus end
systolic.
Okay, and systolic. So what will happen? And systolic volume is increased and diastolic volume is remain unchanged. The stroke volume is decreased, right?
Decrease. Yes.
Okay, one more thing. I give you some mainly what happened. Stenotic lesions. Stenotic lesion. Stenotic lesion lead to the decreased stroke volume, right?
Yes.
And regurgitant lesion lead to
increase.
This is some journal principle. There may be the exception as well. So regurgitant lesion lead to increased stroke volume, right?
Yes.
This makes some sense to you?
Yes.
Okay. So now moving toward this graph, blood pressure and time. So this is left ventricle pressure more than aortic pressure, right? So this line show the left ventricular pressure, right? And this red line show aortic pressure. Okay, so this thing show that the left ventricular pressure is increased. What about this? This pressure is left atrial pressure.
Atrial pressure.
Left atrial pressure, it is normal, right?
Yes.
So it may ask what happened to the left atrial pressure. It remain unchanged. Okay,
It's
I make a
unchanged.
question for you. I make a question for you. So they give you the clinical winner of the aortic stenosis. How will the aortic stenosis present? What is SAD? Syncope, angina, and dyspnea,
Dyspnea.
right?
Yes.
Okay. What is the nature of the murmur of the aortic stenosis?
Crescendo, decrescendo, systolic nerve.
Systolic ejection murmur, and it is crescendo, decrescendo murmur, right?
Yes.
Okay. Sometimes they give you these kind of the clinical winner, right? Okay. So there are many ways to ask this, and you have to identify the pressure volume loop of aortic stenosis. Okay. Sometimes they didn't ask you about this kind of the graph. Sometimes they give you this graph, clinical winner, and they give you the age. If its age is more than 60, so what will be the cause of this pathology? Anybody?
Classification from atherosclerosis.
Age-related calcification, right?
Yes.
So if it is age is less than 60 and this murmur present at the younger age, what will be the cause of this murmur?
Something congenital.
Rheumatic, congenital.
Bicuspid aortic valve calcification. So if it is present at the younger age, if aortic stenosis is present at the younger age, so what will be the possible cause that they will ask in your uh, exam? So they ask about bicuspid aortic valve calcification, right? That everybody clear about the aortic stenosis, right?
Yes.
So everybody have some sense of this pressure volume loop of the aortic stenosis. So again, I am worth repeating because okay, so aortic stenosis, left ventricle pressure increase and systolic volume increase, no changes in, and diastolic volume decrease in stroke volume, and left atrial pressure normally remain unchanged, right?
Right.
Rob, can you identify this graph? This loop?
Yes.
Aortic stenosis. Okay, so next is aortic regurgitation. So two things. Stenotic lesion, what happened to the stroke volume?
Stroke volume will decrease.
Regurgitant lesion, what happened to the stroke volume?
Increase.
Increase. Okay, so you have some sense that regurgitant lesion lead to the increased stroke volume, right?
Yes.
Okay. So what happened to the end diastolic volume in aortic regurgitation?
Increases.
It increases, and diastolic volume is increases.
Increase.
Right?
Yes.
And we already discussed what happened to the stroke volume.
Yes, stroke volume will also increase.
Stroke volume will
increase.
Okay. So here one more thing. This is dicrotic notch. You noted that? So the dicrotic notch is also lost in aortic regurgitation, right? So basically, it is produced due to the closure of the aortic valve. But in aortic regurgitation, the valve is not closed normally. Like there is pathology in the aortic valve, right?
Yes.
Okay. So moving toward the pressure volume loop. So this is normal and diastolic volume. This is normal and systolic volume, right? This black pressure volume loop. So what happened in the aortic regurgitation and diastolic volume? Increase or decrease?
It increases.
Increases. So what happened to the and systolic volume?
Decrease.
It
Decrease.
generally
No.
is generally remains
Decrease.
unchanged,
Yes.
right?
Yes.
It's closer to the normal, right? So if
Yes.
you mean the end diastolic volume is increased, so stroke volume is increased, right?
Yes.
This is again if you compare this one from this one, so stroke volume is increased, right?
Yes.
And one the key thing, there is a large pulse pressure difference, right?
Okay. Yes.
This
So
is
I have a question.
okay.
So is it fair to say that so for the end systolic volume in aortic regurgitation, it will have just what, a mild or slight increase, or we'll say no change?
Generally, we are talking about the generally speaking, but it depends upon the condition as well. So generally speaking, it remain unchanged.
Okay. Okay.
Okay.
So and another thing, so just to make the concept easier, okay, we know that there's a problem with the aortic valve. Okay, so let's say if we pump out, if the left ventricle pumps 50 ml, we can expect for basically 50 ml to return, as in backflowing to the left ventricle again.
Sorry, can you repeat this question again? I didn't understand what are you saying. Can you repeat it
Oh,
again?
I'm sorry. What I was asking was in terms of the concept, to make it easy. We know that with aortic regurgitation, we had, there's a problem with the valve. So is it fair to say, now this has just been hypothetical, that if the left ventricle pumps out, say 50, okay, it has to pump out 50 mLs through the aortic valve so that it goes to the rest of the body to supply. So when ventricular contraction takes place, 50 ml will go, but then say 50 mLs will return.
Okay,
Or is it
I give you the
just a
concept.
section?
So what happened in the regurgitation? So the aortic regurgitation takes place here. So regurgitant mean when you it's a not 50 ml. So blood is pulling back to the chamber that pushing towards the light. So regurgitate means what happened? The blood is the thing that we are pushing in aortic regurgitation 50 ml, right?
Yes.
So what is the meaning of regurgitation? Can you explain me the regurgitant meaning? What is the meaning of the regurgitation?
Well, based on how you look at it, regurgitant is basically like you're having like a repeat.
Backflow of the blood.
So
Yes.
so
Can somebody ask backflow?
Yes, backflow. And that's the reason why I asked, because when you look at the increase, because for example, if we were to send 50, and that's why I asked the question the way I did. If
Okay.
the ventricle was to send 50 and 50 return, then it means that blood would never get supplied to the body.
Okay.
Now, if it's a
Doc,
portion,
you give me the answer in your question. You say that the aortic regurgitation means backflow. Backflow
yes,
from aorta to
ventricle,
ventricle. So this
yes.
backflow happen mainly in the diastole, right?
Yes, okay.
So this backflow mainly takes place in the diastole. So diastole means filling of the ventricle, right?
Yes.
So so the volume that present at the end of the diastole is increased. Why? Because of the backflow of the blood from the aorta, right?
Yes.
Okay. Can anybody tell me what kind of the murmur has the aortic regurgitation? What kind of the murmur?
Early diastolic.
Early?
Blowing murmur. Early
Early?
diastolic blowing murmur.
Early diastolic blowing murmur. Okay. Okay. If it is due to the valvular disease, if the cause of the aortic regurgitation is valvular disease, right?
Yeah.
So where you heard this murmur? Valvular disease.
You said, where would you hear it?
Yes. On chest.
At the root of
On the, no, like around the left sternal border.
Left sternal border. If the cause of the aortic regurgitation is aortic root dilation, aortic root dilation, where can you heard this murmur? On chest.
right.
You're saying we're gonna, then that would be what? Right upper?
Yes, it's a right upper border.
Right second
Right
intercostal
upper.
space.
Second intercostal space.
So if it is due to the aortic root dilation, you will heard it in the right upper sternal border. If it is due to the valvular disease, you will heard on left upper
upper sternal border.
Right? So this is sometime become confusing for the student. Asma, does it make some sense to you?
No, I have a confusion. For the valvular, you're saying that left upper. So if it's left upper, then what will happen with pulmonary sound?
Try to simple, Rock. I'm asking simple. This is so simple. So they are asking about they give you the cause. Like, so valvular causes of endocarditis, rheumatic fever. If the cause of you have the future of the rheumatic fever in the scenario, what will be the where you will expect to heard this murmur, right? On left upper sternal border, and when they give you the aortic root dilation, then it will be right upper sternal.
Right. Okay.
There is no voice, right? Can anybody hear me? Hello?
Yes. Yes, I can hear you. Yes.
Yes, somebody mentioned in chat that there is no voice. Is my voice is clearly audible to everyone?
Yes, it's clear.
Yes.
Okay, one more important stuff related to the aortic regurgitation. So there is a large pulse pressure. What is the pulse pressure? Pulse pressure is
Systolic blood pressure, difference between systolic and diastolic blood pressure.
Difference between systolic and diastolic, right? So this is
yes.
systolic and this is diastolic. So there is a huge difference. Normally it will be at 80 millimeter of the mercury, but you noted that it is below the 80, closer to here. Oh, sorry, here, right? So there is pulse pressure difference, right?
Yes.
And this left atrial pressure again is remain normal,
Unchanged. Yes.
unchanged. Okay, the mitral stenosis. So mitral stenosis, so it is a stenotic lesion. So what happened?
Stroke volume will decrease.
Stroke volume will decrease, right?
Yes.
So, but it is a systolic murmur or diastolic murmur?
Diastolic. Diastolic murmur.
Okay, another general principle, I give you the idea, right? So, systolic murmur of semilunar valve is stenotic, right? And
Can you repeat that point?
Sorry, I say
No, you
that.
broke up a little.
Wait, there are two types of murmur: systolic and diastolic, right?
Yes.
Identification of the murmur. If the murmur is systolic, then it mean that if it is a semilunar valve pathology, so it will be stenotic lesion. Semilunar valve will, which aortic valve and the pulmonary valve.
Yes.
Right?
Yes.
And if it is a diastolic murmur, so it means that the murmur will be due to the regurgitant lesion of semilunar valve, right?
Yes.
So systolic murmur means stenotic lesion of semilunar valve and regurgitant lesion of atricoventricular valve, right? And diastolic murmur means regurgitant lesion of semilunar valve and stenotic lesion of AV valve. Asma, can you repeat that principle?
Okay. Systolic murmur, it means systolic murmur, it means stenosis of semilunar valve like aortic and pulmonary, and regurgitation of AV valve like mitral regurg and tricuspid regurg, right?
Yes.
And diastolic murmur, it means regurgitation in semilunar valve like aortic regurg and pulmonary regurg, and stenosis of AV valve like mitral stenosis and tricuspid stenosis.
Okay. Okay. So this picture clearly showed that and diastolic volume is decreased, right? Because of stenosis of mitral valve. So when diastolic volume is decreased, the stroke volume is decreased. And what happened to the left atrial pressure? Because accumulation of the blood lead to the increased left atrial pressure.
Yes.
So one more key thing. During diastole, sometimes the left atrial pressure greater than left ventricle pressure. This is another key thing. During diastole, I am talking about diastole, not systole. So during diastole, left atrial pressure may be increased than left ventricle pressure. Right?
Yes.
So normally this is the left atrial pressure. This is left atrial pressure. So normally it's somewhere in here. This is normal one. So you noted that the left atrial pressure is increased. So this is a systolic phase, right? And this one is diastole. So what happened in diastole? Left atrial pressure more than left ventricle pressure. But in systole, left ventricle pressure, this is confusing question. If you ask about the pressure changes in diastole, in mitral stenosis, then the left atrial pressure will be more than left ventricle pressure. But they are asking about the systolic phase of the cardiac cycle, then left ventricle pressure will be more than left atrial pressure. Asma, does it make some sense to you?
Yes, yes.
Okay. So next is mitral regurgitation. So as we know that some principle. So mitral regurgitation is a systolic murmur or diastolic murmur. Systolic or diastolic?
Mitral regurgitation is systolic.
Is a systolic murmur. It's a regurgitant lesion. What happened to the stroke volume? Increase or decrease?
Increase.
Increase stroke volume. So this is some high yield principle that I learned from my USMLE journey. So I feel that is a worth important to share these principles to you, right? It's helpful in identification of murmur. Okay, so this is clearly show that the stroke volume is increased. Why is increased? Because and diastolic volume is increased, right?
Yes.
And systolic volume is decreased. You noted that. And systolic volume due to decrease resistance and increase regurgitation into the left atrium during systole. And diastolic volume is increased and stroke volume is also increased. Okay, so here is the dicrotic notch is also present. That is normal dicrotic notch. So you find the tall V wave. Can anybody tell me what is a tall V wave?
Did you say a tall V wave or T wave?
Tall V wave. This tall V wave.
Right ventricular empty in right atrial empty into the right ventricle.
Okay, so there is a pressure, increased pressure of this
I think it has to do with it back.
increased pressure of left atrium, right? It's some sort
Yes.
of the slope. So it's on JVP, you noted that there is a V wave. So this is tall V wave,
Volume,
right?
volume overload, I think.
So this tall wave is present in the mitral regurgitation. Okay, I'm closing this session and I give you another link, then you will join to new link.
Okay.
Let's start. So the splitting. So splitting of S2. why the splitting of S2 takes place. Okay, we discussed this thing in previous session. Can anybody repeat it for me?
Yes, so we had a delay in the closure of the pulmonary valve.
Yes, delay closure of.
Yeah, the pulmonary valve, the
Okay,
pulmonic valve, right? I'm sorry.
okay. So this is a
Yes,
normal scenario. So E represents expiration, right? And I
yeah,
represent inspiration. Okay. So this splitting normally exaggerated in inspiration. So first close aortic valve, right? This aortic valve. After the closure of the aortic valve, then the pulmonary valve close, right?
yes.
So what happened in the this condition during inspiration?
Yeah, during
There will be
inspiration, you have venous return to the right.
increase
delay will increase.
increase venous return, mean increase
Yes,
preload to
the
which
right,
side? Right
the
side.
right side, right side. Yes,
Increase
More
preload to
delay
the
in closure of pulmonary valve.
and this will lead to the delay closure of this valve. So this is
yes,
normal. So this is
correct.
not called physiological splitting that takes place in inspiration, right?
Yes,
Okay. So what is the meaning of the wide splitting and fixed splitting? So wide splitting means the exaggeration of this normal phenomena. Exaggeration of this normal phenomena, right? While the
yes,
fixed, fixed splitting is independent of respiration. This is a independent of respiration.
respiration.
Respiration, respiratory cycle.
And this wide splitting is dependent on respiration, right?
Yes,
Okay. So the causes like in wide splitting take place in pulmonic stenosis and right bundle branch block, right?
yes,
All of these things interfere with the closure of pulmonary valve, closure of the pulmonary valve, right? So this is on expiration, right? On expiration, although the distance is increased as compared to this, so this is increased, right? When we
yes,
compare to this normal. But what happens when you inspire? This is aortic component and this is a pulmonary component. So inspire will further exaggerate this phenomenon. And you know that the mechanism behind why inspiration increase this phenomena. But what happened in the fixed splitting? Hello?
In inspiration, there is increase in venous return.
Yes. Asma, do you have any question?
No, no.
Okay. So the fixed splitting takes place in atrial septal defect. Okay. So atrial septal defect is many point of is a important thing that is a because it is a overlap of the embryology with pathology, right?
yes,
So in this case, you noted that there is an increased splitting, increased difference as compared to this normal. This one is a normal and it is independent of inspiration. This is to inspire, the splitting remains same, right? It is independent of the respiration. Okay, one more thing. ASD was patent foramen avail? I love to ask this question. Okay, PFO is defect in which thing? Embryological defect in. PFO is defect in which thing? Hello? Hello?
Yes, hello. Yes,
Hello?
yes.
I'm asking question from
Please
participant.
repeat.
I ask you
Okay.
what is the embryological mechanism that lead to the patent foramen avail?
Yes, that is would that be flow through the like from from the right atrium to left atrium?
Okay, it is basically
Failure of fusion of septum primum and septum secundum.
okay. This is a failure of septum primum and septum secundum. And what happened in the atrial septal defect? It is a basically
Defect in ostium secundum.
so it's a mainly ostium secundum, most commonly ostium secundum,
Secundum.
right? But it may be due to ostium primum.
Down
When it
syndrome.
yes, when it takes place from the ostium primum, it associated with another cardiac anomaly and it associated with Down syndrome, right? If you Down syndrome scenario, the problem in ostium primum.
Primum.
And if they ask about the most common cause of the atrial septal defect, the defect in ostium
Ostium
secundum,
secundum.
right? So this is again a high yield stuff that ASD and PFO, does they increase the risk of emboli or not?
Paradoxical emboli.
Paradoxical.
Okay. They increase the risk of paradoxical emboli.
Yes.
Okay. So what is a paradoxical splitting?
The vice versa.
Well, that's the fact. Yeah, when you have delay, aortic valve closure delay.
So the paradoxical splitting is reverse of the normal thing. Here, the pulmonary valve close before the aortic valve, right? This is
Yes.
expiration. And what happened on inspiration?
Increase the venous return to the right side will
Okay.
delay it, and also the aortic will delay it, so they will become like approximated.
Okay, approximated, right. So paradoxical splitting, we mainly heard this paradoxical splitting in expiration, while the other splitting of S2 we heard in inspiration,
Inspiration.
right?
Yes.
So what are the causes of paradoxical splitting?
Yeah, like aortic stenosis, LBB.
Aortic stenosis, left bundle branch block.
Yeah.
Anything else? Systemic hypertension and hypertrophic cardiomyopathy. So these are the 4 high yield causes of the paradoxical splitting. Normally, pulmonary valve delay of the pulmonary valve closure produce physiological splitting. But here the order of the closure is reversed in paradoxical splitting, right?
Yes.